If your erection lasts more than 4 hours, you run the risk of permanently preventing that little guy from ever going back up again. As an ER doctor, I have pulled out many objects and many makeup sponges out of this area. Do I need to worry about rabies? Hi, I'm Dr. Jordan Wagner. I'm a real-life board-certified emergency medical physician. My mission is to make videos that answer all your urgent medical questions. And that's why today I'm going to mix things up with rapid-fire answers to some of your burning medical questions. But before I do, make sure that you hit the subscribe button and turn on your bell notifications. That way you know when I post new videos. Okay, brace yourselves. Here we go. Number 1. Can I get herpes from a toilet seat? No. You're safe when it comes to public restrooms for the most part. But the biggest difference between herpes 1 and herpes 2 is that herpes 1 is oral or around your mouth and herpes 2 is in your genital area. While herpes 1 and herpes 2 are in different areas, they can swap positions, so be careful. So I just watched a crazy action movie. In an emergency situation, can you really use a belt as a tourniquet? You can. In my opinion, using a belt as a tourniquet is not as effective in the majority of cases as direct pressure would be to that wound. Save yourself time and effort. Instead of using your belt and taking off your clothes, use direct pressure. What is the best medication to control a fever? Acetaminophen, which is Tylenol, or ibuprofen, which is Advil. They both work well to reduce fevers. Just follow the directions on the label. Next question. I waited in the emergency room for 5 hours. Is that typical? Sadly, yes. Depending on the time of the day or the time of the week in the emergency department, wait times can vary from 5 minutes up to multiple hours. Also, if you are waiting, that is a sign that you're likely not dying versus the person being rushed in right past you who needs immediate care. ERs today are not first come, first serve. The first people that are served are the most ill and the most life-threatened individuals. Next question. Okay, I ran out of tampons. In a jam, can I use a makeup sponge? No. Tampons were specifically made based on a woman's anatomy and menstrual cycle in mind. On a personal note, as an ER doctor, I have pulled out many objects and many makeup sponges out of this area. It can be very dangerous. There's something called toxic shock syndrome that can occur to women, or perforation or puncturing your insides. Don't do it. What is the best way to get a bee stinger out? Great question. You can use tweezers. You can use a credit card by sliding it against the direction that it went into your arm. Or you can use any type of glue, let it dry, and then scrape it off and get all the contents out. Just be aware when you try to squeeze the stinger, there's a top bulb on it that has all the bee venom. So your object is to minimize squeezing that and get it out as fast as possible to minimize any of the venom or pain that has occurred with bee stinging. All right, next question. I went to the nail salon and now I have redness around my fingernail. What do I do? This is very common. You likely have something called paronychia, which is a common infection around the nail bed and the nail itself, which is usually treated at home with warm soaks and topical over-the-counter antibiotics. But if it gets worse, where the infection can develop more, you can get pus underneath the skin. At this point, you need to either go to your doctor, your primary care doctor, your urgent care, or the emergency department where they need to drain it for you. And after that occurs, you might want to check out Yelp for a new nail salon. I've had abdominal pain that comes and goes for a few days. Am I dying? Probably not. It's a likely scenario that you're not dying, and it's a very common reason why people come to the emergency department. It's probably due to being backed up and constipated. Most people are constipated as everyone has busy lives and they miss their body's signal to go to the restroom. And then later when they go, they're already backed up. Think about that over a lifetime. Normally, we should go to the bathroom 1 to 2 times a day. Now, if you're having abdominal pain that has other symptoms, including fevers, vomiting, chills, etc., this could be a signal that you're having maybe an infection or another problem going on and you need to be seen by your healthcare provider, doctor, or go to the hospital. Next question. I have a mysterious bite on my leg. Should I be worried that it's a brown recluse? I hear this a lot at work. Most wounds that people are referring to that are bites are likely early abscesses or localized infections. Usually somebody has not witnessed a spider bite. A brown recluse is identified as a violin shape on their body. It's usually found in attics, wood piles, and storage sheds, so just be aware. It has venom when it bites you that can cause tissue necrosis, which actually breaks down your skin, can cause a hole over time where it bites you. If a brown recluse does bite you, clean the wound, use cold compresses to the area to slow the venom, and do general wound care. Once the venom is started, there's not much treatment for it. You basically have to wait for it to run its course. If your skin gets broken down too much, we can give you a skin graft thereafter. So be careful, not all bites are brown recluse, but have your doctor check it out. I found out a guy that I was making out with has mono. Do I have it now? Mono, aka mononucleosis, aka the kissing disease, is usually caused by the Epstein-Barr virus. It's passed on by saliva, so yes, you potentially can get it that way. There's no treatment for mono, and the symptoms can last up to a month, which includes sore throat, body aches, night sweats, swollen glands, fevers. So watch how you feel, and if you develop any of these symptoms, check with your doctor. Also to note, antibiotics will not work for mono. If you do take them, likely will develop a rash throughout your whole body. I cut my finger and I think I need stitches, but I have to work. How long can I wait before I need to go to the hospital? Well, most wounds that require stitches or sutures should be done within the first 6 to 8 hours. That way you reduce the risk of infection. That timetable can be prolonged a little bit longer for wounds to the face, but again, you don't want to increase your risk for infection. So I think you should use one of your sick days, leave the office and get to the hospital or the doctor's office so we can sew you up. What is the difference between a DO and an MD? In simple terms, a DO is a doctor of osteopathic medicine and an MD is a doctor of allopathic medicine. But in the United States, these two type of doctors go to school for the exact same period of time and they learn the same material. The DO, or in my case, I take an extra course in medical school that has to do with the musculoskeletal system, and we're also trained to be able to do manipulations. I hit my funny bone. It's not funny, so why do they call it that? When you hit your funny bone, which is actually your ulnar nerve on the inside of each elbow, it sends a shock or a signal down your arm, which is weird sensation and tingly, which can hurt sometimes, but they call it funny because it's a weird sensation. Next question. I've had an erection for the last 6 hours and I'm a little embarrassed to go to the hospital or the doctor's office. Is there anything I can do at home to make it go away or any medication that I can take? Stop what you're doing and immediately go to the hospital. This is a medical emergency. After 4 hours, permanent damage can occur to your man parts, meaning if it isn't fixed in a timely fashion, you may never have the ability to get it up again, or you may lose all sensation down there. The ER staff knows how serious this is and will treat you that way. So there's no need for embarrassment, as we want the best for all of you. Make sure you tell your doctor any medications that you might have taken, even if you don't think it was the cause. Last question. I tried to pet a stray dog and now I got bit. Do I need to worry about rabies? Yes, you should think about rabies. Although it is extremely rare in the United States, occurring about 100 cases per year, the usual suspects that can cause rabies are bats, skunks, coyotes, raccoons, and dogs. Dogs nowadays are extremely rare to cause rabies, but if you do get rabies, it's nearly fatal every time. So if you do get bit by an animal, get it checked out immediately by your doctor, okay? All right, that's it. Make sure you guys subscribe and turn your bell notifications on. Thank you for watching, everyone. Stay healthy, my friends.